Okay, if everybody could take a seat. This next panel incorporates four of the brightest people, I think, in the state. I'm going to ask each one of them, like Steve Aquario did, to make an opening statement, but I'm going to take the liberty of making a few remarks about each one of them. And I'm going to start with Dick. Dick, pay attention over here.
I am.
Everybody knows you were MTA chairman and Kerry picked you to do the UDC, so I thought I'd state a couple other facts that people may not know about you. One is that you played tennis regularly with my dad in doubles and actually supported him against you, Kerry, who still loved you and appointed you. So my question is, who is the better tennis player, you or Howard?
Howard.
Okay, well, that's great. Now, one other thing that most of you haven't read, but in reading about this young man, Dick Ravitch, okay, in one article it said they called him the Chubby Cheek Ravitch. Where did that come from, Dick? I read it last night. It's on the web.
The Republicans.
And finally, Dick, when he ran for mayor in '77, had the backing of the ambulance drivers. How did you pull that off, Dick?
You know, I struck out with every other union. They were probably fighting with the Central Labor Council at the time.
But anyway, it's my pleasure
remember.
to even be on the same podium with Dick Ravitch. He's one of the smartest people, and I think Mayor Miner and the rest of us would agree, if we just let him make all the decisions how to fix this, it would be done. So Dick, why don't you give us an opening statement?
That's very kind of you, Bill, and I admire your persistent efforts to make things work better in New York and create a little equity. I want to say three things in my opening statement. It's been fascinating listening to everybody this morning. I haven't heard the word federal government mentioned once, and over a third of New York State's budget is financed from the discretionary budget of the federal government, which has been cut significantly the last 2 years, and given the statements of the leadership of both houses of Congress, is likely to be cut in the future. The impact that that will have on local governments, county and city governments, is going to be profound, and we're not sure dollars, and we don't know exactly where the cuts are going to be. But I would respectfully suggest to you all that you recognize the fact that those cuts are going to happen, and at a time when pension costs and healthcare costs are rising, and local revenues are not, and state revenues are not rising to the same extent. I was very happy to hear my friend Tom DiNapoli's sort of bullish projections. I don't share those totally. And I think given the state of the economy, we have some risks on a going forward basis, which ultimately will be felt at the level of government that provides most of the services. Second point I want to make very briefly is that the federal governments and state governments and local governments, there's a real disconnect. There's no real discourse. I remember when I was in Washington during the brief period when I was in Albany, and I was in Washington during the week that the Congress was considering passing the extension of the Stimulus Act in 2010, the act they passed in 2009. And all the members of Congress from New York State, and most of whom were friends of mine of long standing, we all ended up having lunch in the House dining room one day, and they all said to me, Dick, we're getting tired of voting for more deficit spending in Washington in order to bail out a lot of politicians in Albany who don't have the guts to tax or cut their own way to balanced budgets. I thought that was a fascinating comment, and realized that what happens to education, health care, pensions are not relevant in congressional elections, and therefore they don't have to concern themselves with them. And a few days later, I was the speaker at the annual dinner of the Westchester Mayors Association, and all they wanted to talk about was these proposals to have a property tax cap and how that would tie their hands. And when I asked them how the legislators, the assemblymen and senators in their districts, reacted to this, they said they're responding to the public, which is outraged by the level of property taxes, and they don't care that I, a mayor, may not have the money to, if we have 2 extra snowstorms this winter, or if we have a sewer failure that we have to fix, or a road repair that comes within the jurisdiction of the city. That's not their concern. They're glad to let me sweat that one through. So I am increasingly struck by the disconnect of the 3 levels of government who collectively pay for, and their constituents pay for, the panoply of services that government provides and the mandates that government requires. Sorry for too long a statement, Bill.
No, you're great, Richard. Well, EJ, as president of the Empire Center for Policy, anyone in this room doesn't read regularly what EJ writes and says, and I do, just to check my thinking. We don't always agree, but I have to tell you, I find him one of the more influential minds in the state. And he played a historic role working with Governor Pataki as we reduced our income taxes. So, EJ, what do you think?
Well, first of all, thank you, Bill, very much. Thank you, City and State, for putting on this event. And I do want to thank Bill for seeking to jumpstart a conversation that involves, maybe the phrase you used was big thinking, or thinking on a broader scale. And I think that's a good idea. I think there's far too little of that in this state. There's a lot that goes on in the arena of policy proposals that claims to be big thinking and is actually very small. So I appreciate what you're trying to do in bringing this topic up. I have a few reactions to what you were talking about earlier. The issue of counties, the Medicaid mandate on counties and the mandate of other social services and health services on counties is an interesting one. The main reason nothing has been done about that, actually, to backtrack for a moment, something has been done about that, but we'll get to it in a minute, is really a matter of focus. The really insidious, awful thing about the Medicaid, about the fact that counties share Medicaid costs, the really insidious, awful thing is not that it makes some county executives' job harder, which is, with all due respect to the county executives here, is not the primary concern. It is when it basically blurs accountability and responsibility. Why do we have the nation's biggest Medicaid program? Why are our Medicaid costs consistently so high, and have they been for many years? Because the state legislature of New York for decades was able to mandate coverage levels while paying 25 to 30 cents on a dollar for them. For all the complaints about the level of federal Medicaid reimbursement, the New York State legislature has never had to pay for more than 25 to 30% of what it's spending in that area. That's pretty important. Secondly, where is most of the Medicaid money spent? Where is the principal engine of Medicaid spending? Well, we're in it. It's New York City. New York City is both a funder and a provider, or to put it another way, a payer and a payee. That also reduces the incentive to control Medicaid growth, because if you do too good a job of it, you're creating tight straits in the nation's largest public hospital system, which is a whole other area. And you have politicians in New York, as we've seen even recently, who would prefer to keep open hospitals they don't need for political reasons. So that's part of the picture with Medicaid. Now, you talked about how it shouldn't be too hard to get the ball rolling in the context of a $145 billion budget. Well, that includes the Medicaid reimbursement. Actually, all politics and budget politics in Albany as elsewhere is on the margins. And on the margins of a $90 billion state operating funds budget, it's very difficult to do $2 billion worth of anything. If you're the governor, you can find or invent surpluses of $2 billion at a time and prospectively devote them to things other than this, which has been the case going back to before the current governor. There have been windows of opportunity during past economic expansions when a significant reduction in county and local Medicaid costs might have been enacted, for instance, in the late 1990s. However, the choice then, which we can relate to even now as we see what's unfolding, was to create a $3.5 billion state-subsidized homestead exemption on school property taxes. Now we're looking to expand that with a different kind of program the governor unveiled that would spend $1.7 billion on top of that to subsidize homeowner property taxes. That's the choice that Albany makes because, again, politicians like to be able to claim results from the electorate that they've delivered, and they like to pass the blame downhill. That's the really bad thing. If you talk about big thinking, if you really want to think big, if we could really lift all of the state-mandated health services and welfare services and social services off the backs of counties, if we did a thorough enough job of it, we may not need counties. After all, an entire region of the country north of us has no county government. I'm talking about New England, has virtually no county government. In Massachusetts, counties exist as judicial lines on a map for legal purposes, and they have courts, but they don't have county government. I would say that's another way to think big, but we're not close to getting there, and I don't see as a political matter how you could begin to spend a significant amount of state money that is, depending on how you count, 40 to 55% originating in New York City and a larger percentage in this region to relief of Medicaid. I'd start off the conversation by making one other point. As the comptroller pointed out, it's a line that is in every speech I've heard Tom DiNapoli do on this subject, and it's good that he always makes this point, and I think it kind of goes over the heads of people, but it can't be stressed enough. There is no uniform situation. These are very, very different situations in counties around the state. Very, very different, not just in levels of expense and in local living costs. If you want to talk about the burden of Medicaid in a place like Montgomery or Fulton County, there you've got a really crushing part of the tax burden that can be directly attributed to state-mandated county and health services to serve the poor. They're poor counties to begin with. They're in a death spiral economically. And I attribute this to my friend, the retired and former and frequent adversary of the retired former Fiscal Policy Institute head, Frank Morrow, whose successor is in the room, who used to make the point, and he was right, that you go to a place like, again, Fulton County and Montgomery County, there Medicaid is the problem, and other welfare and public health services mandated for poor people are in a problem in a poor county that has virtually no tax base. And you make a much bigger difference when you relieve that in a place like those counties than you do in Nassau or Westchester. One final point just to kick it off with. I do think, well, I'll save it for later because it's another point. But again, if this was easy, it would have been done. Because it actually is not easy to find $2 billion or its equivalent on the margins of any given budget now or 10 or 20 years ago, they always find something better from their political point of view to do with the money, and that's the problem.
Thank you. You can see EJ and I think 100% the same. But no, I really appreciate it. Mayor Minor, I had the privilege one day to come up to Syracuse and walk the streets, and I have to say, as I watched you struggle when you come into the office at negative thinking of where to find money versus creatively, how to help Syracuse, I was extremely impressed. And I shouldn't say this, but I'm going to say it. I always thought, Mamie in 2018, if she doesn't go to Congress, okay, she ought to think about running for governor. We need a female governor, and she's done an outstanding job. But anyway, give us your thinking.
Thank you, I think, Bill. I'll take that as a compliment. I've had the great privilege of working with everybody on this panel, and they are some of the country's greatest thinkers, and I'm just very pleased that they return my phone calls and emails. I'm going to talk about this from the perspective of an elected official and a local elected official. Clearly, property taxes are a burden, and people are voting with their feet. Florida is about to become more populous than New York State. And in my particular part of New York State, we have there is great desperation. While people are saying the economy is turning around, it's not turning around for the majority of people in my city. But at the same time, there's a great spirit of we can get this done and we can fix things. And I think that spirit is what causes people to run for local office and to continue to stay in local office. I think you heard that from the county executives panel, a number of whom were from different parties than I am. So when you look at property taxes and how high they are and how onerous they are, particularly to lower income people who live in upstate, you start to really see firsthand the problem that it is causing for growth and for people being able to afford to stay in their homes or live in their homes. We on the local level, again, got into office because we want to solve problems. So how can we solve the problem of property taxes? When the property tax cap was first discussed and put into place, I was at best agnostic about it because 52% of my city is non-taxable between hospitals and colleges and governments. And so it wasn't something that was going to directly impact me as a mayor. But I did think that putting the cap on would focus the analysis on what is driving property taxes up. Unfortunately, I was wrong. And instead of focusing the analysis on what is driving property taxes up, it has really been allowed to be a sort of red herring where people get to spin their own facts about property taxes. The reality of local government officials is we're spending money on in my own county of Onondaga, 80% of the property tax levy is spent on Medicaid. In my city, we're spending money on pensions and health care and retiree health care. And when you put binding interest arbitration into that, there are expenses that we can't control. I say that, but I also should say to you that these are services that people not only want and desire, but they expect. The three most expensive services that I have, police services, the Department of Public Works, which collects trash and removes snow, which is a very big deal in Syracuse, and we do it very well. And the third is fire. So when you say, okay, you need to cut, well, am I going to give less police protection? Am I going to give less snow removal? Am I going to give less fire protection? The reality is, as a mayor, my police department is the smallest it's ever been, my Department of Public Works is the smallest it's ever been, and my fire department is the smallest it's ever been. I ran for re-election and I closed a firehouse. I have closed senior centers. So this is not about being creative and innovative anymore. We have done that. This is about actual loss of services that, again, these are not glamorous services. These are what people expect government to provide. So as long as the discussion doesn't focus on let's solve the problem, but instead focuses on, well, let's win the media cycle of the day by casting blame or throwing it on other people, we're still going to be in this position where we continue to lose population, we continue to have people suffer more, and we don't grow as an economy, and we don't meet the tradition of our progressive state. I say that to say that there are local officials as Democrats and Republicans across this state who are willing to make tough decisions, who have already made tough decisions, and sometimes I think question the decision to actually run for office on a local level because it is such a tough job, but want to make the future better for the people who live in their communities. Because after all, when you are a local official, you came from that community, and chances are you're going to go back to that community after your service is done. I have a term limit as mayor of the city of Syracuse, but I have said frequently, look, I am from Syracuse. Syracuse will always be a part of me. It's where my family lives, it's where my friends live, and I want to make it better. And the only way that we can make Syracuse better and New York State better is by tackling this problem honestly. And to date, I do not think it has been attacked honestly. And what has happened is the residents of our state are paying for that dearly.
Thank you, Mayor. Now, our last speaker I did not know, Dr. Mildred Warner. So I decided I better pull her resume. And I may read it to you. It is 46 pages. I've never seen, this woman must work 48 hours a day. But she has an amazing background. And I'm just going to pick a few things. Local government reform, privatization, and public-private collaboration. I'm now on page 4. Worked with the New York State Association of Counties on all sorts of research related to school superintendents. Shared services in New York, presented at the Association of Towns annual convention. And finally, I'm going to skip to 45. I don't think I'm going to do 46. Improving the management and productivity of local government. Now, the reason I mention this is nobody has done more work in thinking about shared services, productivity, technology, and clearly there is a play, if we're going to increase jobs, between efficiency and delivering of services and tax policy. So tell us what we should do, Doctor.
Thank you very much, Bill, and I'd like to thank City and State for inviting me to be here today. As the academic on the panel, I'm just going to give you a few facts. Number one, property tax in real terms across all types of local governments in New York State has been flat for the last decade. Number two, expenditures per capita in real terms across all types of local governments in New York State has been flat for the past decade. Number three, consolidation of units of government does not save money. Number four, tax caps don't work in reducing the actual cost of government. If you want to reduce the cost of government, you need to think about who's paying for what, where, at which level. We've been talking today, the session is titled Big Ideas, and one big idea has been put on the table, which is state assuming the Medicaid responsibility for counties. While that would certainly help counties, I'm not sure how much help it would provide to cities or towns or villages or school districts. And we all pay property taxes at all levels. And so we're interested in thinking about what property tax reform might look like and how we deliver the services that we in New York want and care about and what that should look like. And what I would suggest is for big ideas, we need to really think about structural reform. We need to think about structural reform on the revenue side, widening the base of taxes. We had talked this morning about widening the base of sales taxes. That actually makes sense. We need to think about the very large institutions in our communities that don't pay tax and whether or not that makes sense given that they require services. I work for one, a university. We also need to think about this and continued enthusiasm with tax abatements for businesses that economic development theorists will tell you don't work. We need to think about organizational structure. We built an organizational structure of local government a couple of hundred years ago, and it made sense for that time. Does it make sense for the 21st century? And if we really want to think about what the structure of local government should look like, I wouldn't argue that we get rid of counties. I don't think New England's township model is necessarily the appropriate one for the 21st century. You actually might think about empowering counties and expanding cities to be larger, to grow, because they need to be able to capture. Our upstate cities look like donut holes with poverty in the city and wealthier suburban rings around them. If you want to really solve the revenue problem, you need to think about how you can do tax-based sharing across that. One of the ideas that people put forth is consolidation. It's a political dead end. No one wants to go there. And it's not cheaper, but it might be more fair. We also need to think about unshackling the management of our local government so that they can do the innovation that they've been doing well. How have they kept their expenditures flat in real terms over 10 years? Because they've innovated. They've figured out all sorts of ways to do things better and to do things cheaper, but there's a lot of state rules that get in the way, and Unshackle New York could be part of unshackling the leadership. We clearly need a state partner in all of this, and not so much a blame game as a real partner in thinking about how do we restructure the local government sector to be a 21st century local government sector so that New York State, not just the city, which, by the way, is not subject to the tax cap, but the whole state can actually move forward to be competitive in a 21st century economy.
Thank you. I want to ask a macro question. One of the things that EJ, I think, implied, which I agree with, is that decisions on services and programs, if they're made at a state level, and if that's who is deciding what the benefits are and the charge, it's a reason for centralizing the cost in that area, because you can't just slough it off. I am saying that I believe, and we'll just see what the rest of you think, that the state needs to take more responsibility. I believe, especially if it focuses on productivity and efficiency in addition to standard policy making, that it can do a lot more. So I guess my macro question is, in terms of the mandates, and I really only have studied the Medicaid one, which other mandates do you think all the costs should be at the state, or is Medicaid the most obvious one? Mayor Minor?
Well, I can tell you that binding interest arbitration, every executive that you talk to feels that they have never gotten a fair shake through binding interest arbitration. And when you look at the studies of what has happened and the benefits that end up putting you in this position where you have your employees that you are paying the most, for example, your police officers and your firefighters, and an arbitrator comes in and rules that they only have to pay a certain amount for health insurance, and then you're forced to look at your lowest paid employees, your DPW workers and trash collectors, and say, geez, are we supposed to make it up on their backs when you have to pay this bill? And you know, there's been lots of discussions about binding interest arbitration, but it tends to be one of those what I would call hidden mandates that has the impact, a really serious impact on our bottom line that we feel we have very little control over.
Anyone have anything to add to that?
I'd like to suggest, adding to what the mayor said, because the discussion here today is focused on mandates that add cost, or that mandates that involve a direct cost. Some of the worst mandates are those that dictate how local governments do things. This is how you will do business. These are the rules under which you must collectively bargain with your unions. You have no choice. Those mandates, I think, have as great an effect as some of the others you've talked about, if not greater. I mean, in addition to binding arbitration, which, by the way, the governor has virtually unilateral authority to end or significantly reform, because the law is temporary, expires every few years, and could have been significantly reshaped a few years ago and was not. There's a law called the Triborough Amendment. The Triborough Amendment is what guarantees that all provisions of a labor contract remain in effect after the contract has expired. That includes a piece particularly costly for school districts, which ensures that wage increases on steps, which most teachers are on for most of their career, continue to unfold even when there's no contract. It changes the dynamic of negotiations. And schools will tell you it has a very significant effect both on the cost and on the psychology of collective bargaining. So those rules and others, last just throwing out purchasing. The counties for years have had items on their agenda. I think the cities have too, about purchasing rules and about some of the rules under which you either can or cannot think about sharing services and doing an insurance co-ops. It was funny, I heard the governor at something last year talking about, and by the way, frankly, the governor's scapegoats, the governor's follow-up to the property tax has been to basically scapegoat local governments. That's his narrative. He said, we need to share, he was talking about shared services, there ought to be some mechanism where schools can get together and do cooperative purchasing and share services. Well, welcome to 1968. I mean, that's BOCES. Why do schools have a love-hate relationship with BOCES? Why? Well, there's a lot of answers to that. Some people in the room could suggest them, but maybe we ought to think about that and explore that, because it has been invented and it's not always working well, and we ought to figure out why.
Thanks. Dick, here's my question. If Governor Patterson, because he went to a Yankee game and got free tickets, had resigned, and you became governor, what were a few of the big things that you were just itching to do?
Well, I wanted to respond to some very thoughtful other comments, but the answer to that question is probably, given the political atmosphere in 2010, I wouldn't have accomplished anything. But I certainly would have tried to generate a revenue stream to support an infrastructure program for the state that would prevent the rapid deterioration that's occurring both upstate and with the MTA, and I would have tried to do exactly what you spoke so eloquently about in the beginning and very generously referred to the paper that I wrote. But let me remind you all of some sort of baby principle, and that is that, mandates are a reflection of the values of a society. They are onerous and in some cases expensive, but they exist whether it has to do with religious or racial discrimination or the problems of the handicapped. You run the whole gamut of these mandates, and most of them are nothing but reflections of values. And if you argue that those decisions should be made at a local level, you're in effect arguing that the values of the society shouldn't be uniformly applied. And that raises a very, very interesting question. And I think that the fact that city and state's having this conference and that there's an increasing interest in this general subject merely reflects the fact that the whole structure of American federalism is up for grabs. And if I may, I'd just like to make one other point, and that is there are $300 billion of tax credits being granted by states and countless trillions of dollars of real estate tax abatements being granted by cities. The Hyatt Hotel still pays no real estate taxes in New York City, and its assessed value is $350 million. You just look around this city and draw up every real estate site that is exempt from taxes, and why, and ask yourself why. Look at the revenue loss associated with that. New York State gives out $800 million of tax credits to companies that make movies here. Every other state has a comparable tax credit. So people aren't making the movies here because they could get a tax credit they can't get elsewhere. They're making them here because there are certain kinds of movies that want to have New York City in the background. So there is a fundamental question as to whether or not it's not just how we pay for things, it's what level of government should be responsible for what kind of decisions in this society. And whereas I totally respect the fact that people in New York State are suffering from the reduction in population because of the competitive attractions of many other places. But I just want to assure you that as the population increases dramatically in Florida and Arizona, they're not without their fiscal stress. Arizona had to sell its state capital to balance its budget last year. And ultimately, as people move there and jobs move there because of the relative attractiveness of their tax structure, the next thing you know, they're going to need a subway system. They're going to need mass transit. They're going to need public hospitals. They're going to have an increasing number of low-income wage earners who are vulnerable to shifts in our economic base. And this is a very, very volatile scene in this country. And those people who are looking in a kind of macro way at our economy and at the growth rate and at the relevant facts concerning the competition from the rest of the world, you have to say that we are in the process of re-examining very fundamental things. James Buckley had an op-ed piece in the Times in the Journal the other day, the former senator, who Pat Moynihan beat in 1976, suggested that the federal government ought to eliminate $650 billion of federal transfers, discretionary expenditures to state and local governments. You would instantly have 50 bankruptcies. Well, not technically, because states can't file. I mean, the most absurd thing in the world. And there's almost no serious discourse about this kind of thing going on. But believe me when I tell you that the fundamental demographic and economic changes that are occurring in the United States and the shifting responsibilities between the three levels of government is going to become the major domestic issue. So this very thoughtful day, and I'll shut up in a second, Bill, this very thoughtful presentation takes one piece of it, but you can't take it out of the broader context. I do want to remind you that both Governor Cuomo, not this one, the prior governor, his father, cut income tax rates in New York State. So did Governor Pataki. The income tax rate is significantly less than what it was during a period of great prosperity in New York. So I'm not sure that it was the income tax that caused the loss of population or the relative lack of fresh investment. Providing people with the opportunity to come here and not pay any taxes, I'm not sure it works. And I think that academia could study that a lot more carefully than it does, not intended as a criticism, but as a suggestion. And we have to begin to think about, if we want to maintain our values in this society, about what we do for people who are unfortunately not beneficiaries of significant either talent or income to live competitive lifestyles, and that is an increasing percentage of the population. We have twice as many homeless people in New York City than we had at the beginning of the Bloomberg administration. We have hundreds of thousands of kids in the public schools in New York City who are living under the poverty level. I mean, these are not facts that you can ignore, and yet there is a generally in our culture rather anti-tax mood that seems to be a good campaign slogan for people who want to run for office. But how that jibes in the context of meeting the essential needs. And to come full circle, that's why what Bill eloquently described in his comments earlier, to replace the property tax with an income tax to pay for our share of Medicaid seems a no-brainer to me. I wish that political leadership of the state would take this up seriously.
Okay, to finish up, Dr. Wagner, I want to ask you a question. I've known you have studied the states around us and the relative responsibilities that the state takes for local services versus the state passes down the burden on the counties. Where does New York State regionally fit in terms of state responsibility?
We're number last. So the idea of decentralization is that you decentralize expenditures to the lowest level possible, ideally where the decision about that expenditure is made. But the U.S. Census of Government Finance measures what percent of state and local expenditure is handled at the state level and what percent is handled at the local level. And in New York State, we spend the least percent at the state level. And this goes a long way to explaining why local property taxes are so high, because if local governments are having to bear, and when I say local governments, I mean cities, counties, towns, villages, and school districts, when they're having to bear more of the burden of these expenditures, they rely much more heavily on the property tax, so therefore they have to pull it from the property tax.
And to put it in perspective, it's what Mayor Miner said in 2013. Property taxes are regressive, income taxes are progressive. I happen to be in the camp that thinks you don't have to increase taxes, that you can do it at a $150 million budget by running things better. Okay, if there's one or two questions, and then we have to go to the next panel.